very much. All these people are not putting the helmets on. This is something that we need to do because this is the work that we began a long time ago, not today. So I'm going to wear my helmet as I speak with you. It really is a pleasure to be with you this morning, and I bet you that when they decided to invite me, no one probably knows this. But I began my career 31 years ago as a Riga doctor. The Rhode Island Group Health Association, which is one of the funders indirectly of this building. The Rhode Island Group Health Association, or Riga, as the old-timers in Rhode Island know it, used to be a staff model HMO whose mission was to provide comprehensive primary care and specialty care to its members under the same roof. And just like the beautiful building that we're going to be building here, Riga tried unsuccessfully, unfortunately, to grow this concept. And when that HMO was closed, the funds that resulted were placed in trust at the Rhode Island Foundation, and some of those funds are now being used to create this beautiful building. So I am going to take credit a little bit. This one brick, of the building was as a result of the work I started doing 31 years ago. Today, the OBGYN group that I lead has been for many years working with Blackstone Valley Health Center, providing obstetrics and gynecology services, and together we already deliver most of the babies born in the Blackstone Valley area. And at a time when many provider networks seem to be in competition with each other, Blackstone Valley Health Center and Women's Care, which is now part of the Care New England Medical Group, have forged a partnership with a single purpose, that of providing the highest quality service to women and their newborns, regardless of their ability to pay. This is primary care with capital letters. Primary care with capital letters. Creating a single clinical enterprise that can serve the entire population of Central Falls is groundbreaking. And I can't think of another place in the nation where a community health center has been able to collaborate so effectively with the city government, with private partners and philanthropy. Together we're bringing prevention and clinical care to everyone in this community, whether they're documented or undocumented, rich or poor, Spanish-speaking or English-speaking or Portuguese-speaking, black or white, because this coalition of caring, dedicated professionals are listening to the community, responding to their needs and working together. We're creating a culture of health right here in Central Falls, one that can actually measurably improve the public's health. Just think about it. Everyone in Central Falls is going to live less than 1 mile away from this wonderful facility.
That sounds good.
I know it's true that everyone in Central Falls lives 1 mile away from everything else, but it sounds great. I wanted to say that because it sounds great. Many of you know that I host a daily health show on Latino Public Radio, and by the way, Latino Public Radio is broadcasting this event live right now. So go to your Twitter and say, tweet that you can listen on www.lprri.org. But the stories that I get during my call-in radio show are sometimes heart-wrenching. Patients going to the ER, not knowing what's happening, coming out with prescriptions that they don't understand, with referrals to places that they've never been to meet with people that they don't understand or don't speak their language, just dealing with language, social, cultural, educational barriers that basically make people sick. Patients are bouncing from doctor to doctor in search of answers with no one to put the entire story together and finding not just what's wrong, but finding solutions to their problems. Sometimes physical ailments, or many times physical ailments, are mere reflections of lives in chaos due to economic and social pressures. And the prescription is not antibiotics, antacids, or antihypertensives. but someone to listen to their complaints and needs and help them lead healthier lives. This facility is not just a building, but a mission of comprehensive care that seeks to deal with the social determinants of health, and a beacon of hope to one of the most impoverished and needy communities in terms of resources, but a community that is rich on its diversity and, yes, hope in the American dream. So join us in this most important venture that seeks to do in Central Falls and surrounding communities what has eluded many efforts here and elsewhere in the country to create the healthiest community that includes all of its residents. Thank you very much.